Good evening and welcome to another episode of the program Easy Access to Healthcare for All, a program that brings you updates on the activities and happenings around the National Health Insurance Scheme. The year 2021 was very critical for the NHIS as it recorded milestones and victories in its operations and in its quest to attain universal health coverage. Some of these achievements include signing of MOUs, launching of innovative programs, restoring stakeholders' confidence, automation of its processes, in addition to establishing of health insurance under one roof, among other milestone events. As the NHIS prepares to take off with even more momentum this 2022, we would like to refresh your memories on how 2021 went. And that is exactly what we shall be doing in this episode of the program. Why don't you join me after the break for the full story? I am Aisha Muhammad Ahmed, your regular anchor. Please don't go away.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. In the news, management of Federal Mortgage Bank of Nigeria visit NHIS. Details of these and more coming up shortly.
The management of NHIS on Thursday, 13th January 2022, received the Managing Director of Federal Mortgage Bank Nigeria and his team in its headquarters in Abuja. The visit by the FMBN was to understudy the NHIS automation process and to foster a partnership between the two agencies. Speaking at the event, Managing Director FMBN Architect Ahmed Nangiwa said, "The visit has become necessary as both agencies operate in a similar manner, even as the mortgage bank is also working towards digitalizing its operations to help expand and serve Nigerians better."
And studying NHS is a very good initiative on our own side. Since we are just developing it, we intend to flood the core banking application by February this year, end of next month. I felt that it's very important for us to come because we have a common identity. NHS drives its own funding from the collections of the contributions by Nigerian workers. So also the FMBN, we drive our own funding through the NHF collection of 2.5% of Nigerian workers. And it's through this funding that we fund all our operations and we create mortgages for Nigerians. So therefore, we at FMBN will recognize the importance of ICT in any business venture.
While responding, the Executive Secretary NHIS, Professor Nasir Muhammad Sambo, lauded the management of the FMBN for taking the steps towards digitalization. He also pledged his support towards this partnership as he briefly gave a rundown of the processes the organization took towards actualizing the eNHIS project.
As a professor of public health, I know the importance of partnership. As a very long consultant with United Nations, I know that you can achieve a lot with in the spirit of partnership. So, and I always emphasize to my people that in as much as there is any governmental partnership or any kind of partnership that will add value to our system, they should not hesitate to bring it up. So I think it's courageous by the Federal Mortgage Bank to be around. And through a lot of conversation, we met the Honorable Minister and informed him that we want his sister agencies to support us in putting up this eNHIS roadmap. So NASCOMSAT was selected to come and help us. And we sat in this call and we gave them a pictorial idea of where we want to be in future with respect to ICT. And we explained detail of our business processes to them. And they went and joined our team and they started working. So we employ a government-to-government approach. to establishing the ENHIS.
Prince Nasiru Ikaro, General Manager ICT of the NHIS, gave a brief presentation on the ENHIS.
We have the call management system, which is managing our complaints. As they come in, people come in, we'll see the expansion of that immediately. And then we have the EDMS that is interfacing with the ENHIS, Electronic Document Management System.
Prince Nasiru Ikaro also spoke more on the visit by the Mortgage Bank.
The significance of this visit from the Federal Mortgage Bank of Nigeria is the fact that we are able as NHIS to showcase the elements of the ENHIS, a dream that has come true for our government and also for Nigerians. ENHIS is a complete migration of NHIS business processes from a manual environment to that of an electronic state. And what that does is it allows us to provide good quality care or good quality services to our enrollees across board.
Welcome back. The program is Easy Access to Healthcare for All. In the year 2021, the NHIS recorded remarkable landmarks in line with its mandates. In this episode, we bring you a review of some of these milestones. Let's take you through the activities that define the year for the NHIS. Please stay tuned.
Easy access to quality healthcare for all. NHIS.
One major task given to Professor M.N. Sambu on assumption of office is to attain universal health coverage by the year 2030. To achieve that, Professor Sambu undertook some major reforms ranging from rebranding the scheme to developing a 10-year strategic plan.
On the very day I came, I assumed office on the 15th July 2019. I unveiled a 3-point rebranding agenda, which is anchored on restoring value system within the National Health Insurance Scheme in order to make NHIS a credible, result-oriented organization. Number 2, to engender transparency and accountability in the entire operations of the National Health Insurance Scheme. Number 3, to accelerate the drive toward attainment of access to quality healthcare in line with President agenda and in line with Sustainable Development Goal.
Along these lines, the NHIS has recorded milestones both in its operations and implementation of the scheme. Following the launch of the giftship program in 2020, the year 2021 saw the new flagship program of the NHIS gaining acceptance. The Nigerian Bar Association (NBA) took a step to register 1,000 of its members into the giftship program.
Our game plan or our strategy was to encourage our members by, as an association, paying for 1-year subscription for 1,000 of our members. That was our strategy, and I came to let you know, I'm delighted to inform you that we have done now. We caused to be transferred to your account in the central bank 15 million naira for 1,000 of our members, which I have a list here of the 1,000 members who we are hoping you can onboard into the scheme, the giftship scheme, as soon as practicable.
If we launch this program and we have lawyers coming in, who will not come in? Nobody. Today we say that the lawyers of Nigerians have recognized NHIS as a viable organization, and they come up with 1,000 people to join a newly launched program of NHIS. This is a story for the national insurance.
Still on expanding access to healthcare, The National Youth Service Corps also signed a Memorandum of Understanding for a health insurance product of NYSC members.
History is being made, and I know what it takes as a historian for this opportunity given to us by the President to enroll our corps members in this program. It's an indication of the concern of the federal government for the welfare of corps members.
So what is left for the corps is to reciprocate the government gesture by ensuring that they dedicate themselves and commit themselves to the national service. At one point or the other, we were all corps, and we have been able to perform our stewardship work. So we will call on the corps to reciprocate this gesture of the government by ensuring that they rededicate themselves to the national duty.
Drugs administration is often in question under the NHIS, and so Professor Nasser Sambo has brokered partnerships to improve drugs administration under the scheme. To this end, MOUs have been drawn up and signed with various companies of repute, including Farm Access and Roche. The impact of the MOUs cannot be overemphasized.
We are here to deliver qualitative healthcare to all Nigerians. That is the mandate. And we cannot do it alone. We need partners of repute like you to do this. And that you have offered to come up with this MOU that will support our operations is a thing that is not just commendable, but it is well appreciated.
The partnership with Roche is of particular importance, especially as it relates to NHIS beneficiaries having access to quality cancer drugs.
The essence of the MOU is to partner with the NHIS. On the first thing is to bring qualitative medications through a reimbursement model to make it available for cancer patients in Nigeria. And there are top-notch medications that are used all over the world, biologic medications, to make it accessible to Nigerian patients who have enrolled with the NHIS. Primarily for cancer treatment, there are first-class biologic medications that are used in the UK, the US, and we have to make it available for Nigerians.
Still in 2021, the NHIS held an engagement with drug management agencies towards refining its medicines policy aimed at creating drug security for NHIS enrollees by making it affordable as well as available for Nigerians when they visit the hospitals.
Following the engagement with the drug manufacturers, an idea came in where we established a committee that will work to develop this NHIS drug initiative. It was a multi-stakeholders committee involving Ministry of Trade, Ministry of Custom Services, state health insurance agencies, committees of medical directors, SC Bank, committees of healthcare providers in Nigeria, and many other stakeholders.
The automation of the NHIS operations is one area the scheme has achieved tremendous success. When the Executive Secretary hosted the Minister at the site of the ENHIS project, it was commendation for what the Ministry has achieved.
From what I see so far, I'm impressed. It will be a great leap forward in the management of health insurance in Nigeria. So one of the problems we have now is health financing. And health financing is not just availability of funds and resources, but the management of funds. So the e-management of resources, e-management of financial processes will help a lot towards universal health coverage.
Quality assurance remains top priority for the NHIS. In 2021, it revalidated health maintenance organizations while providing them with training on how to work with the scheme.
In tracking whatever is happening within the ecosystem, and NHIS don't hesitate to make any punitive measures that is within the provision of the guideline of the NHIS for any actor within the system that has gone against any of the provision of the act. So I implore you to go back and read all the documents of the National Health Insurance Scheme, including the newly developed 10-year development plan and the one-year giant stride activities that we have done in the process of reform.
Still on quality assurance while refining its processes and procedures, the NHIS recruited medical personnel for all its state offices and the FCT Abuja to help it deliver effectively on its mandate. The new staff underwent a comprehensive 2 weeks induction before they were posted to their various places of assignment.
If you look at the functions of the National Insurance Scheme, the core activities that is undertaking, there is a lot of accreditation of healthcare facilities. There is a lot of monitoring for quality assurance. There is a need for effective referral system. There is a lot of reconciliation, financial reconciliation that is done based on the kind of sickness that has been treated by the healthcare professionals. If you don't have requisite healthcare professionals, how can these activities be undertaken?
There were retreats, stakeholder engagements, and staff trainings. The NHIS also made its presence felt and its voice heard in various health meetings across the country. Many will agree that the NHIS has never had it so good, and its determination to attain its objectives have never been more visible. Little wonder then that the NHIS boss ended the year with special recognition from within his organization by the NYSC members who served there and from without, as he was recognized as the doyen of public health by Stardom Global Television.
Welcome back from that break. Easy access to healthcare continues in our stakeholders segment. The National Assembly is a critical stakeholder in the attainment of universal health coverage. We spoke to the chairman of the Senate Committee of Health, who is a key player in the health sector, Senator Yahaya Oloriegbe. Senator Oloriegbe was instrumental to the amendment of the National Health Insurance Bill, which is awaiting assent. An ardent believer in health insurance, the senator recently launched the gift-ship program in his constituency with 2,500 beneficiaries. He expressed his views on the gift-ship program.
My impression will be, I'm aware of the strategic paper for it. I've read it. I've not yet seen it in operation, except now when I've launched it in my constituency. So I think the next few months will enable me to be able to have a better feedback. But based on the feedback I think I had from how it is being done in Zamfara, where I'm aware it started earlier, I'm sure that my people who are beneficiaries will have a good experience on it because it will enable them to be able to access healthcare without financial catastrophe or financial hardship.
Senator Oloriegbe gives an assessment of the effort of the present leadership of NHIS as it relates to achieving universal health coverage.
However, during the administration of the current ES, I think a much more concerted effort from strategic perspective has been put forward. First and foremost, for an organization to be able to expand its activities, it needs to get its organizational structure, its organizational methodology together. And the current years, I'm aware, has been able to do that because we oversight the organization by not only rebranding, but by developing a 10-year strategic plan, which is able to provide a kind of direction as to where the organization will be going. But far more than that, is the effort of NHIS working with us in the National Assembly to put a legal framework that will ensure universal health coverage is achieved. And that legal framework is to amend, or so to say, I think we actually repeal and reenact the entire law of the National Health Insurance Scheme by creating a National Health Insurance Authority. The key feature of that bill is making health insurance mandatory.
He speaks further on more features of the amended bill that will help expand coverage.
Well, it's easy to say in the law to say something must be mandatory. There must be resources to back it up. And we are aware that the financial structure of this country is such that we have majority of the population, up to 70%, that are living below poverty line, depending on the definition of $2 per day or so, in which case they are vulnerable and they won't be able to have the means. So the law also provides for the establishment of vulnerable group fund and getting funding for this from different sources. And in addition to that, the bill also has some other provisions in terms of the restructuring of the NHIS, in terms of how it deals with various stakeholders within the sector. It does have, particularly when we talk about sectors, how do you link the NHIS with the sub-national level, which is the state, because Nigeria operates a federal system, and we cannot achieve universal health coverage without the state's health insurance scheme coming on board, both for the formal and for the vulnerable groups. Now, the Basic Healthcare Provision Fund, which is already operational, require the guideline which has been passed, which has been developed, and it has been released and signed by all the relevant stakeholders, the ministers and the head of the agencies, NHIS and NPCD. These are all part of the effort to make health insurance coverage expand for us to achieve health coverage.
With a scheme of projecting 2030 for attainment of universal health coverage, how can the National Assembly support the scheme in this quest? Oloriegbe explains more.
Well, the National Assembly has done its own part by passing it in the bill. We have various amendments were done to various laws relating to tax, custom and exercise, and trade, and something that relates to trade tax, education tax, and so on. So it is through that means. So the way we can make that to come, we have addressed that in the new bill, not by putting 1 crore per second, but by creating a special fund known as the Vulnerable Group Fund, which will come from budget, in which case it will come from whatever tax any other tax that is done, just like we got the Basic Healthcare Provision Fund.
That was Senator Yahaya Oloriegbe speaking on the NHIS and the attainment of the universal health coverage. We will now take your questions in this last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
Question: are children covered under NHIS?
If you look at the way the NHI is structured, what we call the formal sector program, the public sector program, if a principal who is like the worker gets enrolled, who's the spouse, the children under, biological children under that principal, 4 of them under the age of 18 years, covered under the program until they get to the age of 18, when they can now join other programs to continue.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled? How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
Easy access to healthcare for all every Saturday at 8 p.m. on the NTA network service.
This is where we draw the curtains on this episode of today's program. Join us again same time and on this same station for another interesting episode as we continue to bring you more stories of happenings around the NHIS. Enjoy the rest of your evening.